On July 18th, 2017, my life changed forever. I was driving in the car on my way home from picking up my son from daycare, and my heart started beating out of control. Like I felt like I couldn't catch my breath. It was kind of scary. So I pulled over, I called 911, and I went to the emergency room. Later on that night, I was diagnosed with Hashimoto's thyroid disorder. Hashimoto's disease is a common hypothyroid disorder. It can affect people of all ages and all genders, but it's mostly common in women. I'm going to inform you on the basics of Hashimoto's disease and explain some of the causes, the symptoms, and the treatment. Hashimoto's disease is an autoimmune disease and is a condition in which your immune system attacks your thyroid. Your thyroid is a small gland that is located at the base of your neck. It's kind of in the shape of a butterfly, and it makes hormones which regulate your metabolism. Hashimoto's disease is the most common cause of hypothyroidism in the United States. Large numbers of white blood cells which are part of the immune system, build up in the thyroid and make the antibodies start the autoimmune process. The immune system attacks the body's own tissue and attacks the thyroid. Doctors are not entirely sure what causes this to happen. Scientists do understand that there are some factors and that some people are more susceptible to this disease, such as if a person has a family history of thyroid disorders, which in my case, my aunt has Hashimoto's disease. There's also non-genetic causes. Men, women, and children can get Hashimoto's disease, but for some reason, women are more susceptible to the disease. Studies have shown that those suffering with Hashimoto's disorder, 7 out of every 10 of them are women, and usually they're between the ages of 30 and 60. There are some symptoms of Hashimoto's disease, which are right here: forgetfulness, infertility, dry skin, foggy brain, anxiety, hair loss, fatigue, and weight gain, especially if your diet hasn't changed. There's also other symptoms, which is pale skin and increased sensitivity to cold, which was one of my major symptoms, and muscle aches or joint pain. Hashimoto's disease is treatable, and usually it's pretty simple and effective. When you go to the doctor, you can get a TSH test, which is the best screening test. And it's the most common blood test that's used to evaluate how well your thyroid gland is working. There's also an antibody test, which measures your antibodies in your blood. The body produces antibodies when the cells in the thyroid become damaged. Sometimes people have to have surgery, and one of the most common reasons why they might have to have surgery is if they have cancer. If a person has Hashimoto's disease, they have to be observed by a doctor for the rest of their life. And they usually have to go in and have lab work done every 6 months. And they just pretty much check the levels and make adjustments to your medication if needed. The most common type of medicine is Synthroid, which is levothyroxine. It's the most commonly prescribed drug by doctors. Synthroid provides a steady dose of T4, which is the storage form of the thyroid in your hormones, or thyroid hormones, for your body to convert to T3, which is the active form. And it comes in a wide range of doses, and it's very convenient and effective. There isn't a cure, unfortunately, for Hashimoto's disease, but there are ways that you can help with the symptoms of Hashimoto's disease, such as there is an AIP diet. And an AIP diet is a strict diet that removes any inflammatory foods. This is a list of some of the foods that you can have. Just a list of beans and coconut products, nightshades, oils, fats, herbs and spices, fruit, meat, fish, and poultry, teas, natural sweeteners, vegetables, and some additives. Then there are a list of foods that you cannot have, which are a list of nightshades, the sweeteners, the grains, the beans, dairy, which is very hard for me, eggs, oils and fats, fruits, teas, herbs and spices, nuts, additives, and of course, alcohol. Another way to help with the symptoms is exercise, which is fun, but it's very beneficial, short-term and long-term. But Hashimoto's disease is a lifelong condition with no cure. However, it can be controlled. The sooner a person is diagnosed, the sooner they can start receiving treatment. I have explained the causes, the symptoms, and the treatment for Hashimoto's disease. I hope now you have a better understanding of this disease. Thank you.